I am Harry Campbell from Biofeedback Resources International, and I'm going to be going through some information on BCIA certification. BCIA stands for Biofeedback Certification International Alliance, and it's the most known and accepted certification available for biofeedback and neurofeedback, both nationally here in the US and internationally as well. So, going to just be giving some information about certification, the certifications that are available in the process, and the reasons for certification. Okay, so first of all, these are some of the purposes of certification. So, it's a way to set some minimum standards. There are not, at least in most places, a license for doing biofeedback or neurofeedback. And so the sort of way to set some sort of quality control is through certification. And so the BCIA does provide certification. And um, it is a way of at least establishing that a person has gone through some process to prepare themselves to be able to provide the services. It also helps us to avoid having people using biofeedback or neurofeedback without knowing what they're doing. It helps to clearly identify what biofeedback is and what neurofeedback is. For instance, there are some technologies and therapies out there that may be somewhat similar to biofeedback or neurofeedback, or might be used along with or instead of biofeedback or neurofeedback, but they are not one and the same. And so electrical stimulation, audiovisual entrainment, these are some things that are sometimes mixed up with biofeedback. And then I think there are some things that may, to a degree, be purposely labeled as biofeedback to sort of help with getting coverage from insurance and things like that. These are some of the reasons why the certification is useful. It helps to educate people who want to do biofeedback or neurofeedback that it is more complicated, or there's more to it than a person who, a company that may just be selling instruments to professionals that might want to use biofeedback would think. And it helps to set the educational guidelines, since often the training is not readily available at colleges and universities or hospitals. Okay, so this is what the BCIA website looks like. If you want to get all the details on BCIA, you can go to their website, bcia.org, and you can work your way through and drill down deeper than we're going to in this session to get more information. So I'll go back here at the top of this, you have a place where you can select what you're looking for. And if I select that I want to see information on biofeedback certification, then I would drill down and get more information on that. Here, we're going to just kind of look at a chart in the next slide that shows some of the differences between biofeedback and neurofeedback by the type of disorder that you might be looking to work with. So often I get people that are interested in training, but they'll ask which training they should do. Should they do the biofeedback or the neurofeedback training? And I'll usually say, well, eventually it would be good to do both of them. But we might give some guidance as to which one to start with. And there are times that a person will not do both, but they would do the one that's most appropriate to the conditions that they want to work with. So here it shows what biofeedback is, and it shows what neurofeedback is. and gives you some of the differences between the two. Biofeedback, we're talking more what we would call peripheral biofeedback, and that's dealing with surface EMG, skin temperature, skin conductance, respiration, and heart rate or heart rate variability. Although there is also a separate certification for heart rate variability if you want to specialize in heart rate variability, or if that's the only modality you want to work with. Okay, then the neurofeedback is also referred to as EEG biofeedback, and that is going to focus on brainwave activity as well as HEG, which has to do with temperature changes in the brain. And we'll, in the next slide, see some of the differences between why you might want to choose biofeedback versus neurofeedback. And then you have pelvic muscle dysfunction biofeedback, which is another specialty area that a person could get certified in. And that's going to focus more on pelvic muscle disorders like incontinence and pelvic pain. All right, so now this is the chart that I was talking about, and it shows the different applications and which of the modalities would be more suited for it. So I'll just read off a few of them. Not going to go through the whole list, and this is something that if you want to see the list in detail, if you contact me, I'd be happy to send it to you. You can also get it through the bcia.org website. So for instance, ADHD is listed as an application, the first application. The modality listed for that is NF or neurofeedback. So if someone came to me and said that they want to get training to do feedback for working mostly with ADHD, I would guide them to the neurofeedback training because that's the one that's going to be most appropriate. If we go to something like anxiety, it says BF NF. So that means biofeedback or neurofeedback, or biofeedback and neurofeedback would be useful to work with anxiety. For asthma, it just lists BF, so that would be biofeedback. Chronic pain lists biofeedback. Autistic spectrum, neurofeedback. Fibromyalgia, biofeedback and neurofeedback. Headaches, biofeedback. Insomnia, biofeedback and neurofeedback. And then last one I'll list there is traumatic brain injury, and that lists neurofeedback. So you get the idea, and this list would be helpful in choosing which type of training you would want to start with. So if we selected from the top menu bar there, biofeedback certification, we can also choose which pathway for certification we were interested in. And I chose for the purpose of developing these slides, to choose the biofeedback entry level. Entry level is what most people would be doing. There is a certification by prior experience, but that's only going to apply to someone who's been doing biofeedback for a long time and wants to get credit for that rather than going through the pathway that a brand new person would. Okay, so this would give us the information if we wanted to get certified um, through the entry level pathway. So it starts out by giving BCIA approved healthcare fields. And though that's what you would need to see what you would need in terms of the fields that are approved for the certification for biofeedback. All right. And then it lists entry-level certification for licensed applications, and then entry-level certification for peak and optimal performance. So they have two different types of biofeedback certifications there. One for a licensed person that would be wanting to work independently, and then they also have the entry-level certification for people who are not looking to work with diagnoses, but just working for peak performance types of applications, and they wouldn't have the same requirement for being licensed. You can also click where it says the brochure, and you can get a brochure that gives a summary of the information on this certification. There's a human anatomy and physiology course requirement. And here it says comprehensive course in human anatomy, human physiology, or human biology, covering the organization of the human body and all 11 systems, taken from a regionally accredited academic institution or a BCIA approved provider is required. Candidates should complete a course that best supports their biofeedback practice. And there's additional information you can get on the type of course that would be acceptable, and we can help with guidance on that. So this is a screenshot of the brochure that I mentioned before. It has the requirements for professional certification. It gives the prerequisite education, the didactic biofeedback education, where the 42-hour program that would be required, like the programs that we offer for biofeedback certification. And then it has the practical biofeedback training, 20 contact hours with a BCIA approved mentor. And it shows the things that you would be reviewing there, 10 sessions of personal biofeedback training, 50 sessions of patient client treatment. And that should be broken down into 10 sessions with thermal or temperature, EMG, and heart rate variability. And then the remaining 20 of the 50 sessions are to include any combination of EMG, thermal, GSR, heart rate variability, and respiration. And then there's 10 case studies that are also required. There is an essential skills list, and that needs to be submitted by each person that is applying for certification. They list here the human anatomy and physiology course. And if it's for professional certification, that would be for independent practice, then they would require that you have a license or credential for independent practice. There is a exam, and the exam you have up to 3 hours to complete the exam. It's given virtually online, and they proctor it electronically. There is a recommended sequence for meeting these requirements, but it's not cast in stone. You can complete it in the order that's comfortable for you. Some people like to wait till the very end to take the exam. Other people want to take the exam very quickly and then do the other work. I definitely suggest that you study for the exam. It is definitely passable if you study, and most people do pass, but people who decide not to study at all have more trouble with it. So, I mean, that's just logical. So, I definitely suggest putting the time in to study, and we can recommend some study aids for that as well. Here you have the didactic education, the 42-hour didactic education program covering the blueprint of knowledge, which you can also click and drill down to get the details of that. The mentoring practical skills training, and what I just read off about the 10 sessions of personal training, 50 patient client sessions, 10 case studies. Those are full detailed patient client stories from intake and protocol selection, adjustment through discharge. And those can be cases that you present to your mentor presents to you, or the BCIA also provides case review webinars that you can take advantage of. There is a biofeedback mentoring handbook, and you can download that and get all the information, the detailed information on this process. Gives you instructions here for filing an application. And you've got to have an application on file before you can apply to take the exam. And it shows you what the fees are for those things. Here it gives you details on the exam construction. It consists of about 100, sorry about that. It consists of about 100 multiple choice items that only have one correct answer. You don't get a penalty for guessing. The number of exam items from a blueprint area correspond to the number of hours in that rubric. The smaller the rubric, the fewer questions will be in the exam from that content area. Okay. And there's another link you could click on, Biofeedback Exam 101. So that would give more details. There's a core reading list that, again, you can drill down by clicking on the link. And there's a FAQ that you can click on. And then the similar information for neurofeedback. So this is the neurofeedback entry level certification information. And if you were to click on the bar at the top, you would get this page here that gives you details on the neurofeedback entry level certification. It's very similar to the biofeedback. You can click on the brochure for the neurofeedback certification, and also mention here that there's a technician level certification which requires that you are currently working under legal supervision of a licensed and BCIA certified provider. Okay, and there's information detailing that. For the neurofeedback certification, there's a neuroanatomy, neurophysiology, physiological psychology course that is required. And there's the didactic education to learn the science, history, and theory of neurofeedback. That's a 36-hour program. There's the BCIA blueprint of knowledge and the accredited didactic training programs, links for all of those things. Mentoring, practical skills training. So similar to biofeedback, you have to go through the same process, except there are a few differences here. So 25 contact hours instead of 20. 10 sessions, that's the same for self-regulation. So those are personal sessions. Instead of 50 practice sessions, here you have 100 practice sessions for neurofeedback. And again, you have 10 case study presentations. There is a separate neurofeedback mentoring handbook. And the information for filing an application is very similar to that of the biofeedback. Again, you have to have a valid application on file before registering for the exam. The exam is 100 multiple choice items. They give you 3 hours to complete the exam, and there's a Neurofeedback Exam 101, core reading list, FAQ links that you can click on for more detailed information. This is additional information about the exam process. And here it's listing the BCIA approved licenses and performance degrees for certification. These are some of the things that they want the practitioners to learn and know. So how to operate the equipment, how to record the signals, how to teach voluntary control to the students, clients, or patients that you're working with, how to analyze and understand the data, and very important, how to distinguish between real biological signals and one that's created or caused by an artifact or noise, as we would call it. Okay, and then we have other certifications. So you have biofeedback. There's pelvic muscle dysfunction. That's what I mentioned about for pelvic pain and incontinence. And then you have your heart rate variability. So we talked about the biofeedback and the neurofeedback certifications, and just touch slightly on the heart rate variability, which we can talk about, and I'll maybe do another video on that. For heart rate variability, people want to specialize in that. And then if you want more information on any of these, you can let me know, and I'd be happy to give you more information. And again, you can get detailed information on the BCIA website as well. So thank you for listening and watching. And if I can be of any more assistance, please give me a call, or you can send me an email. Thank you.